Welcome to the Metabolic Link, a medical and science-focused podcast that explores the common thread of metabolism in health and disease. This is where science meets society. Hi, welcome back to another episode of the Metabolic Link. Thank you so much for being here with us today. I'm your co-host, Victoria Field, along with my fellow fantastic co-hosts, Dr. Angela Poff and Dr. Dominic D'Agostino. And today we're going to be covering just a really incredible and exciting topic in terms of where the research is headed for this. We're talking about cancer. And today's title of the paper that we're going to be diving into is Restricted Ketogenic Diet Therapy for Primary Lung Cancer with Metastasis to the Brain, a Case Report. And Angela here is going to actually take us through this paper with great detail.
Awesome. So this is a really interesting area of research. It's one that Dom and I have actively worked in for a while now, and it's a very promising field. There's a lot of unanswered questions still in this field, too, though, which makes it especially interesting to study. So this was a case report, so a report of a single individual who was treated with a restricted ketogenic diet following standard of care. This came out of, a collaboration between Boston College and the University of Thessaloniki in Greece. So in this study, it was a case report of a 54-year-old man who had non-small cell lung cancer that had metastasized to the brain, and he had multiple lesions in both lobes of the brain. He went through standard of care at the time, paclitaxel and carboplatin chemotherapy, and whole brain irradiation. So he saw some therapeutic effect to that. The tumors shrank, but were still there. 3 months later, he initiated a calorie-restricted 3-to-1 Mediterranean-style ketogenic diet. Even though this is a little bit less of a severe macronutrient ratio, so a lot of times a therapeutic ketogenic diet in something like this might be more like a 4-to-1 ratio, so this was just a 3-to-1, he still was able to reach a pretty significant level of nutritional ketosis. Over the course of time that he was on the diet, his glucose was in the range of like 60 to 70 milligrams per deciliter, and his ketones were hovering around 2 millimolar, which is pretty impressive.
Yeah.
So 2 years after beginning the ketogenic diet, and in that time period, following cessation of the full course of his standard of care, he didn't go under any other concurrent treatment alongside the ketogenic diet after that time. And they redid the scans to look at the tumors and their status at that point. And the brain lesion in his right frontal lobe had decreased in size. Originally, 2 years prior, after chemotherapy and radiation, it was around 4 centimeters by 2.7 centimeters in size. And it had decreased over that period of 2 years where he was undergoing the ketogenic diet to 1.9 centimeters by about 1 centimeter. It's about half the size that it was. And then the mass in his upper right lung lobe had decreased from about 2 centimeters by 1.8 centimeters to 1.7 by 1. So also another meaningful decrease in size. So fast forward, he continued the ketogenic diet for 9 additional years, and during that time, his lesions remained stable. Interestingly, at that point, though, he developed some pretty significant dyslipidemia. In particular, his triglycerides rose quite significantly, and he made the decision to come off the ketogenic diet at that time, but he remained stable about 2 years later. So really impressive results in this individual, which of course it's hard to know on a larger scale what that might look like, but this was pretty impressive response.
Certainly was, especially considering the highly aggressive form of cancer that this man was suffering from. And there's so much we can cover in this in this paper, and primarily because of your work too in the field. So we've dedicated this entire episode to this paper because I think we're going to kind of piece it apart. And to start, kind of take a step back and a big sort of macro view of really the foundation of this paper and why these researchers took the approach of nutritional intervention. I mean, really the premise of this is cancer metabolism. So why don't we take a good crack into cancer metabolism, where the research is right now, and why and how a nutritional therapy like this might have such a good impact on cancer in the way that it did in this case.
Yeah, sure. So cancer metabolism is a hot area of research in the field, and it's rapidly growing. It's increased dramatically over the past decade, really. And there's a lot of investigators looking to target the metabolic pathways that are at play in tumor growth. So if you think about it, tumors are growing abnormally. You have cells that should not be dividing and making copies of themselves that are, and they are, ignoring signals that tell them to stop doing this, and they're living much longer than they should. Sometimes they're defined as immortal at times, so they're living forever. They're avoiding apoptosis, things like this. And the way that a tumor is able to support this is in large part due to the altered metabolism that tumors will acquire. So it takes a lot of energy and a lot of building blocks to build a new tumor. You are making all these new copies of cells, and you have to make a lot more energy, and you have to get all of the building blocks, so like the lipids, the DNA, and the proteins that get packaged into these biomolecules. And so what we see is tumors, which are very smart, in my opinion.
Unfortunately.
And what you just described is really the hallmarks of cancer.
Yeah.
And, all these things, metabolic interventions, really, I mean, we can talk, if we have time, how it kind of hits all the hallmarks of cancer in one way or another.
Yeah.
And I think that's an important point, because a lot of pharmaceuticals are being developed to hit, for example, angiogenesis or immune regulation or metabolic dysregulation, but metabolic-based therapies that target metabolic physiology and biochemistry are kind of hitting many of these things, including immune evasion, and it can reactivate the immune system. So sorry to interrupt, but
no, that's perfect. Thank you. Yeah, that's a really great point. And so I think a lot of people are very familiar with this understanding that cancers have genetic mutations within the genome of a tumor cell is just jam-packed with mutations, and these mutations can be found in very important genes, oncogenes and tumor suppressor genes. Oncogenes being a gene that, when it is improperly activated, can promote cancer growth. So something that might normally tell a cell, okay, you need to make a copy of yourself. But in the context of cancer, that might be mutated so that that gene is always on. And now that cancer cell is constantly telling itself to divide. So that would be like an oncogene mutation. A tumor suppressor gene is basically the opposite. So a gene that, when it is, its normal function is to suppress something that might cause cancer. So a cell that would tell a damaged cell to undergo apoptosis. And when you have a mutation in that gene, all of a sudden, well, that's not properly functioning. So you have these genetic mutations that are instructing the cancer cell to do things that normally it shouldn't be doing. And then that's like the genetic side. And then on the metabolic side, the cell, in order to follow out those instructions, has to have the energy and the building blocks to do that. And so upregulating, especially glucose metabolism, is a really huge part of most cancers' metabolic phenotype. So, and that's getting to your question, sorry, 5 minutes later.
Yeah.
But the question of why are people studying, in particular, ketogenic diet? So glucose metabolism is upregulated in the majority of cancers. In some cancers, very much so, and especially aggressive cancers, metastatic lesions, you usually see a very strong glycolytic phenotype. This is actually, exemplified by FDG PET scans that literally just show sugar or glucose uptake. And that's you can identify where tumors are, metastatic lesions are, because they're sucking up so much glucose. And they're doing this. It's kind of debated as to why maybe they're doing that, but they're doing it. And they use it to their advantage, and their advantage is to fuel the tumor's growth, allowing the tumor to make energy and make building blocks that support and allow for that rapid growth and proliferation. So,
and some of the tumors that are more hot on a PET scan and more glycolytic are typically those that have more mitochondrial damage or irregularities, and that could be driven by tumor hypoxia. As a solid tumor grows in mass, the core becomes anoxic and hypoxic, and that further damages the inner core of the tumor and turns on drives many drivers, oncogenic drivers, to become more aggressive. And like Angela said, the FDG PET scan is a great way to image the location and the aggressiveness of tumors. And we think that these tumors will be more responsive. I think the field at large thinks that tumors that are hotter on a PET scan would be more responsive to a metabolic intervention. So that can include pharmaceutical compounds like PI3 kinase inhibitors, glycolytic inhibitors like 2-deoxyglucose, but also metabolic interventions that lower blood glucose, elevate ketones, and maybe most importantly, suppress the hormone insulin, which is a driver for glycolytic activity, glucose uptake, and many of the growth pathways associated with proliferation and growth. So, and that's what a ketogenic intervention does, especially if it's calorie restricted. It does that. So
glucose plays a pretty big role here. But if we were to separate it out, huge,
well,
big role.
It's more like a biomarker of how the glucose ketone index and is more of a biomarker to determine adherence to the ketogenic diet. But really, the low glucose and the elevation of ketones especially is indicative of lower insulin, which would correlate to lower IGF-1 and other growth factors associated with proliferation, growth, metastasis, and invasion of the tumor.
So let's talk about ketones specifically and kind of separate out. You guys have really kind of dived into on the glucose side of things, but ketones themselves, through some studies, such as your own, have shown BHB may actually have anti-tumor effects. And BHB being beta hydroxybutyrate for those listening. And that's really interesting because, ketones play a big role here too, just as a standalone. So if you guys want to explain that a little bit more.
Yeah, it is really interesting because I think, the initial idea behind the ketogenic diet was all based on what we've just been discussing of how important and how widely utilized glucose metabolism is. It's kind of like stepping on the gas pedal for tumors. For many tumors, use this strategy to really drive their tumor growth. And so the idea behind ketogenic diet therapy in cancer was really based on that premise, and largely that premise alone early on was that, well, maybe we can suppress glucose. And when you go on a ketogenic diet, your baseline glucose does go down, not too dramatically typically. And I think that's probably part of it. And I think you are especially probably, dropping postprandial. You don't have postprandial glucose spikes, which in the context of maybe a tumor that's really glucose avid, that would be like a pulse of energy and supply to that tumor on a daily basis, like following meals. But I think, Dom, you're absolutely right. Insulin is playing a huge part of this story. So, suppressing baseline insulin and also postprandial insulin, I think, is as important in the whole ketogenic diet application for cancer. And cancers do overexpress insulin receptor, and they are driven, many are highly driven by insulin. So what was interesting, though, and has been kind of more of, I would say, a surprise or a little more unexpected, was that there is some preclinical evidence that ketones themselves, regardless of the background concentration of glucose or whether or not the model system is also being given a full ketogenic diet, that ketones can elicit anti-cancer effects in certain model systems, and this has been reported in several different model systems by now. We've done some of this work in our own lab in a very aggressive metastatic cancer model that was derived from a brain tumor, and it was a little unexpected, but we think that we're starting to understand maybe why ketones are really potent signaling molecules. And this is something that has only been really described, more recently, and especially within the past decade. We're starting to understand that ketones they'll directly, bind to cell membrane receptors to activate signaling cascades within the cell, some of which there's reasons to think they could have anti-tumor effects. They also can influence gene expression through histone deacetylase inhibition. Tumors have a highly dysregulated epigenome, and they are actively silencing tumor suppressor genes. And there's some data to suggest that that ketones could re-establish the expression of some of these tumor suppressor genes through this epigenetic mechanism. And then ketones also, influence immune function. There's data to suggest that the ketosis aspect can improve anti-tumor immunity, and also influence things like oxidative stress. So cancer cells have lots of oxidative stress, and they can actually benefit from that. And ketones can alter the levels of oxidative stress in the tissue as well. So, at first glance, it maybe is a bit surprising, but once you start to kind of look at the mechanisms, there's actually like a lot of different reasons why for some cancers we might be seeing this effect.
And metabolic too. I know there's some evidence, and I think maybe we reviewed papers a long time ago that ketones decrease glycolysis, and like directly maybe through hexokinase or other glycolytic enzymes. So you have ketones influencing metabolic control, glycolysis, immune-based factors, and also anti-inflammatory effects, but also redox modulation. So reducing glycolysis through suppressing insulin and glucose availability would influence different pathways within the cancer cells, including the pentose phosphate pathway, which is used to sort of generate glutathione to maintain redox status. So reducing glucose and insulin and then reducing glutathione could make cancer cells more vulnerable to interventions that kill cancer cells through a redox mechanism, through oxidative stress. And many chemotherapeutic agents, and we know that radiation can directly damage cancer cells through DNA, but the large part of the main pathway through which radiation kills cancer cells is through generating reactive oxygen species. And so if you have a metabolic intervention, ketogenic diet, that lowers the threshold for cancer cells to protect themselves against an insult, an oxidative stress insult, which essentially is what chemotherapy and radiation is, then you could make them more vulnerable to that therapy. And we think along the lines of immune-based therapies, we know that there's evidence for checkpoint inhibitors like PD-1 inhibitors that they synergize well with the ketogenic diet. So chemotherapy, radiation, and various immune-based therapies could be further augmented and enhanced in the context of a ketogenic diet.
It's really exciting to hear about ketones themselves, sort of separate from glucose and some of those effects, especially because I'll mention from the implementation side, I've had the opportunity to work with some cancer patients through my work with a nonprofit organization in implementing metabolic therapy. And while getting your ketones up to an elevated level, impressive here, over 2.0, I think it was, it can sometimes be really challenging to get blood glucose as low as you might want. Like I think it was in the 60s for this gentleman, which is really impressive and can be really challenging to do with a patient who's maybe simultaneously going through some treatments or just due to simply the stress of a diagnosis like that. has elevated blood glucose levels and has trouble getting that down, knowing some of the potential effects of ketones and having that presence there was encouraging, I will say, when working with patients who might be discouraged because they feel like they have to get, under a certain number. And that can be really difficult for some patients. So it's great to see some of the results here, but that's not 100, it's not always typical. And there's so many variations and things that can kind of happen. One other thing I want to kind of dive into that you guys briefly mentioned that's really interesting is that the ketogenic diet was stopped after about a decade due to dyslipidemia. Triglycerides were measured and they were exceptionally high at the end of this. Granted, there were some periods of time where triglycerides weren't really followed here, but the researchers vaguely sort of mentioned this relationship between cancer activity and dyslipidemia. So let's talk about that potential connection between lipids and cancer metabolism, because I think that's a really interesting case. And also, too, like, there may be some things at play here to where you see such a potential spike, because we don't have all the data over the entirety of the 10 years. But talk a little bit about lipids and the relationship to cancer metabolism, maybe to start, and then we can kind of dive into that part of the paper.
Yeah, so cancer cells are, as I said, very smart, and they really do make the best of any situation that is handed to them. And they will, upregulate pathways to be able to support their growth and proliferation in any way that they can. And so lipids are definitely a part of that. There's a lot of active research looking at targeting lipid metabolism in cancer as a potential therapeutic. So many cancer cells will increase their uptake of circulating fatty acids. They'll also even increase fatty acid synthase, so they start making their own fatty acids. All of this is going, again, to support that growth of the tumor. And elevated triglycerides and elevated circulating cholesterol are both associated with cancer risk and poorer outcomes in a variety of cancers. So, cancer metabolism is complicated, and they really do have a dramatic kind of shift in most of these metabolic pathways. They try to do as much as they can. So there's certainly like a very, within the tumor itself, lipid metabolism is extremely modulated, and then how that relates to systemic lipids is an interesting question that I'm not sure is really pinned down. And I think that's kind of what they were saying, is like, maybe there is a relationship here, but I think they said, but we don't really know. We need to kind of do some studies to figure that out.
Yeah, more research for sure. And also on the same front, cholesterol in general, and a response from a ketogenic diet to, like, those of us, myself included, who are hyper responders, meaning you have like an initial big spike in cholesterol, not usually, I would say, triglycerides, but cholesterol up front, right, early on. And that still very much needs to be investigated. But it's interesting that after 10 years, there was this potential rise. Granted, again, we have, I think there was like an 8-year period where triglycerides weren't measured. So we don't know if it was like, slowly climbing, but it's an interesting point of the paper, I think, and an area that we really need to further understand. So you can feel comfortable, even if, like myself, I felt great transitioning to a ketogenic diet. My C-reactive protein was super low, triglycerides were low, but my cholesterol was off the charts, but I felt good, and all of these other markers were good to go. What does that mean? Like, should I continue and feel good, but is there a risk there, right? We don't really fully understand that.
In the context of this scenario, where you have a patient that's essentially an outlier, given that he was diagnosed and treated with a form of cancer where that he has outlived what would typically be normal, dyslipidemia would not be a health risk that I think should be a factor. Maybe I think you got to look at the whole picture, the picture as a whole,
and probably the individual's risk tolerance.
100%.
It's hard with when you think about all of the factors at play. I mean, there might be a point at which he decided, I'd really like to, it's 10 years. He's in his 60s at this point. Maybe he wants to return to a more standard diet, right? So maybe there's just other things that might be influencing decisions. And
Yeah.
and we only got like some really small pieces of the puzzle, at least in terms of what was reported. So there was just one report of some pretty wonky numbers, but maybe there was more to the story that we're not aware
There's
of.
a lot of pieces that are missing that would give more insight into this. And I think, like, for example, insulin. So we don't know what insulin was, and I think that's an important factor. And with only a few numbers with the triglycerides, it's that can change depending upon your physiology, if you have an infection, if you've eaten a little bit right before, if the patient wasn't fully fasted going into it. So typically what happens, though, with a ketogenic diet is that triglycerides do go down pretty remarkably, and that's due primarily to the suppression of insulin, which increases fatty acid oxidation. Obviously, his liver was undergoing significant beta oxidation of fatty acids because that's necessary to contribute to the production of ketones and beta hydroxybutyrate, which was elevated and sustained throughout this protracted period of time where the tumor shrank. So, but one would assume that his insulin was pretty low, but it's counterintuitive that his triglycerides would be up and maintained at that level.
Yeah.
So.
And I think you touched on something that I did want to point out. I mean, this was really a remarkable response, which is fantastic, of course, for a case report. The ability to understand if this is something that would be, more commonly seen in larger trials is hard to say. So there haven't been, to my knowledge, large clinical trials in advanced small cell lung cancer using ketogenic diet therapy, showing whether or not this is an outcome that, might be applicable to many other individuals. Of course, it's incredibly encouraging and that needs to happen. Now, there have been some other reports. There was actually a University of Iowa clinical trial that was published not too long ago in this exact same kind of scenario. It was locally advanced non-small cell lung cancer. It was small, and that trial failed due to compliance issues. So they were not, I think, only maybe 2 of their 7 or 8 that they started with were able to maintain the diet, which is an interesting question and something maybe Victoria can comment on, because I know this is not like a simple thing to like actually do in a clinical trial setting. And this is a medical intervention, right? That requires a lot of oversight and thoughts. But there was a 2019 study published out of Turkey using a metabolically supported chemotherapy protocol, and that included ketogenic diet, also hyperthermia and hyperbaric oxygen, and 44 non-small cell lung cancer patients, all with distal metastases, and they didn't report any compliance issues at all, which is great. Now, it wasn't powered enough to determine survival effects. They did say that they thought there was probably going to be a therapeutic effect if they were able to do a larger trial. So again, it would be great if that, came out so we could really know. But just seeing the difference between, different sites maybe being able to implement versus not speaks to the difficulty of doing something like this in a vulnerable patient population.
Yeah, it's really can be quite challenging, and it's a totally different approach from, I've in the past trained athletes and people that are high athletic, with high athletic ability, to then working with cancer patients, which was dramatically different. However, at the same time, there are some elements you can kind of pull over from that. And also, I will say, knowledge around the ketogenic diet and the dramatic shifts that happen as you transition onto a diet and how to best support that, having like a true fundamental understanding and making it palatable and fun and interesting for people. When you go into some of this research, it can be very, of course, serious, like what we're trying to do or the end result we're trying to get after, but not missing out on that element for the patient in bringing them into a perspective that's motivating, that's exciting, because this allows for them to be a part of the equation, a part of their treatment, and feeling like they can actually do something, really patient empowerment. And so taking that kind of approach, and honestly, it might sound silly, but mindset with these patients. And I think there's something to that when it comes to behavior change in making people feel a part of it, but also excited about it and like they have an opportunity here is really a piece of that compliance issue. And then also providing options and making it more sustainable. So some of the nutrition protocols that we used with cancer patients, you know, traditionally would start at like maybe a 3-to-1 to get into deep ketosis, but then we would transition into a 2-to-1 once you found some balance. And this is even with GBM patients, right? And you would still produce some of those same results, but it would be more realistic and sustainable, which I think is so important in understanding that this person is also going through, you know, taxing therapies and stress with family. And so
and
when
the
it
protein
comes,
would be higher too.
right, exactly,
And I
which
think
is helpful
that's
in many ways.
From having more liberal amounts of protein is going to be really important to prevent muscle wasting and cachexia, which we talked about earlier.
Part of the reason we did that,
factor,
100%, because some of these patients started in a place where, you know, maybe they were on the thinner side, so you have to be really mindful of that. And two, you know, it's, you know, you're looking at even a 3-to-1, you're drinking a lot of fats and things that
that's lower protein than like the standard American diet, a 3-to-1 too.
100%,
So that, you know, and you know, there's people out there that are promoting low protein, very low protein, actually for longevity as it pertains to cancer prevention and also cancer treatment. But in the context of having a disease process where, you know, muscle wasting and cachexia is accelerated, getting that extra protein and maintaining the body weight is really important.
Totally. It's a very complex balance too. You know, it's, you want to get sort of the GKI listed here in this paper is wonderful, but you want to take into all these things into consideration around like stress and what they're going through there, and protein and keeping muscle mass on these people, and also like I said, making it sustainable and enjoyable, and essentially, you know, a lifestyle intervention at the same time that maybe they don't see as, you know, they see as something they could consistently do and get something out of it as a whole.
Yeah,
So
I mean, I've talked to patients that have come to me after talking with other dietitians, and they were getting like 20 or 30 grams of protein per day on like more of a plant-based diet, but keeping the fats kind of, and like really no appreciation or focus on the importance of protein. So, and I think it almost needs to be like a central macro when you're designing a ketogenic diet, especially if you have a patient coming in that's underweight. You know, if you have a patient that's overweight and has some weight to lose, then you could be a little more restrictive with protein. But if a patient's underweight or already experiencing cachexia or sarcopenia, then that protein really, you need to stabilize the body weight, because that weight loss and muscle loss and strength loss is going to be directly correlated to outcomes. You know, maintenance of the protein and strength correlated positive outcomes, and loss of it rapidly correlated to a negative outcome.
absolutely. I mean, you'll get maybe potentially lower blood glucose with something like a 3-to-1, but if you're able to shift down to a higher protein, like 2-to-1, it's less stressful for the patient, and you have the presence of ketones. Could that kind of balance things out? These are questions that we really don't fully have the answers to, but in being able to experience it with a patient, I think you could say there's some benefits to making it a little sustainable, and maybe not getting as low on the blood glucose side, but having the elevation in ketones might be enough. Who knows?
And insulin, I mean, you elevated protein enough, you know, to have like 2-to-1, I guess you were saying. I mean, I've seen blood work over the last couple of months of several patients who were doing a modified Atkins, and meeting, and it was mildly caloric restricted. Their IGF-1 and insulin were very low. I mean, actually, you know, would be treatable low. And their main concern coming off of a vegan plant-based diet was that they absolutely needed to suppress that IGF-1 as low as possible. And the numbers before and after insulin and IGF-1 were actually lower than, and the patient was actually gaining weight, and IGF-1 was lower and insulin was low, you know, like 2. So, you know, there is that, if you get protein, you could jack up your IGF-1, you know, with higher protein, but there's a particular threshold, and a lot of patients, you don't get that threshold unless you're really getting in like a ton of protein, like, you know, 2 grams per kilogram or more, and you go above that, which may be needed actually in some cases, but typically not to maintain muscle.
Yeah.
Yep.
Right.
And all of these things are things that really have to be sussed out. Like, we don't
Yep.
know. And it probably is dependent on cancer type. It's probably dependent on the individual, their metabolic status. And, you know, so, and these are things that as these therapies move further into clinical trials, thankfully there's lots of them now ongoing, and we're starting to see results coming out of that. I think researchers behind these trials have to be very mindful of designing it in a way that allows us to kind of understand, because a therapy is only going to be effective if it can actually be implemented. So, you know, for example, this trial that ended up failing because of non-compliance, you know, perhaps there was a different way, you know, now knowing, we could take a closer look at exactly what happened, knowing, okay, well, maybe there's a better way to do it. And maybe, like you were saying, maybe this, you know, ratio of the diet doesn't give you the theoretically the most valuable in terms of what you might expect or want from a theoretical standpoint. But if that isn't attainable for the patient, it doesn't matter at the end of the day. And doing something that's actually attainable. And I think
Quality is important. Quality of life is really
Super
important in all of this.
especially
too.
when you're talking about someone that's facing a terminal diagnosis.
Exactly.
That's maybe one of the most important things.
Yeah, that's hard to like take away some of those. You know, it's really hard to adapt. Like, you can adapt a ketogenic diet to like family settings that might, you know, be heavy in carbs and things like that. 3-to-1, it can start to get really challenging to do those kinds of things where you feel like it's an inclusive experience, and you're talking at the end of life.
Yeah.
That's very, very hard to get a patient to. So I think there's got to be a level of sustainability here with patients, and being mindful of muscle mass too, right? And some of the work that Dr. Colin Champ that we've talked about before, what he's doing, where does weight training and strength training fit into all of this as well? One thing that we talked about in some of the patient work that we did was, what are you doing exercise-wise? You know, I think there's a lot of like nervousness around what you can and can't do with a cancer patients, of course. But he really talks about kind of pushing the boundaries there and focusing on some functional, good, strength-based movements to keep the muscle mass they have, and hopefully maybe, you know, post-treatment put some additional on, what that could mean for that person's life and extension potentially of life.
Yeah. Absolutely.
Aerobic conditioning and probably important too, but doing exercise, resistance exercise to keep that muscle on, probably even more important than aerobic in this context, because that function is super, super important. So I don't know if it was discussed if that patient did any kind of exercise protocol, but
I don't think they
I mean,
really.
exercise is a very profound metabolic therapy, and one we'll discuss more often on this podcast. You know, in addition to diet, I think you need to appreciate the potential of exercise, which is underappreciated and understudied, but a lot of good research on exercise and cancer as a therapy, but also as prevention.
Yeah. And I think just kind of capping off this study with it being, you know, highlighting something that was really an incredibly remarkable response, you know, it gets me thinking about just kind of understanding that like the trials that are coming out and the data that's coming out is really, I think, supportive of the fact that there's probably going to be a really useful place for this in the clinic, and there's probably going to be responders and non-responders. And I've talked to people who have, you know, been running some of these trials, and they really see, it's almost like what they describe, you know, and is that maybe it's something kind of like an epilepsy, where there's some individuals who, in epilepsy, we call them super responders. Those people who respond to a ketogenic diet, their seizures stop immediately and forever. And that's incredible.
Even when getting off the diet, right?
Yes, and literally can come off,
Yeah.
right? And so I think there might be some super responders. Why? Probably because that individual's tumor was really metabolically adapted in a way that the ketogenic diet is hitting all the right buttons. But there's a lot of heterogeneity in tumors in terms of their metabolism, and they're also they're able to form resistance to things. So I think that's probably why we see, at least in, you know, the preliminary data that's coming out, responders, some people respond really well, some people might get some benefit, some people might not have any really change. And then, you know, there could be certain cases where it's not something that you would want to apply. There's some preclinical data showing that, that so we talked about ketones being signaling molecules. So there was a lot of times when we talk about cancer and ketogenic diet, people ask about a paper that came out a few years ago in BRAF V600E mice. So this is a very common melanoma mutation, and it was a paper that showed that acetoacetate, which is one of the primary ketone molecules, in the context of a ketogenic diet, stimulating that tumor's growth. So that's certainly something that's concerning and needs to be really looked at. What's interesting is that is happening through a signaling pathway. And that's already been reported. It's actually one reason why we think that ketones can prevent muscle loss. So there was another paper a few years prior to that showing that exact signaling mechanism was one reason why ketosis slowed muscle growth in a catabolic disorder. So it's this very important signaling molecule. So if you're talking about a tumor,
slowed muscle growth,
slowed
or
muscle
breakdown.
Okay. Sorry.
Okay.
Yeah. Sorry if I said that backwards, but
I remember that paper.
Yeah, and so if you had a tumor, perhaps like this model was it's a mouse model, so it's a little bit less complex than maybe what we see in humans, where you have a portion or most of the cells that are really running off this signaling pathway really drives that tumor growth in that model. And you throw in ketones that activate that pathway. That's not surprising that you saw a negative response, but even in that context, you have to think about kind of like the net effect. So ketogenic diet is changing a ton of stuff, right? You're probably lowering glucose, lowering insulin, altering a lot of signaling pathways.
By itself, but also as an adjuvant setting too, can further augment that and maybe make something where a patient was non-responsive or failed the standard of care, if that standard of care is repeated in the context of a well-formulated ketogenic diet with super low glucose, insulin, and ketones, then especially with augmenting the immune system, that could be a different,
like in the
PI3 therapy
kinase
altogether.
Trials.
Yes,
exactly what they saw.
Yeah, with PI3 kinase, you have a counter-regulatory increase in insulin, so the ketogenic diet suppresses insulin and sort of unmasks the therapeutic benefit of these drugs. Still under investigation, but it seems to augment that.
Yeah, but all I was trying to get out is that I think there's a lot of complicated changes that are happening in the context of ketogenic diet, and depending on an individual's specific tumor, and how it's adapted in the environment it's grown in and what mutations have randomly happened in the metabolic pathways, that you're going to see, a difference in some respond quite well, some don't, maybe some are, not, indicated and could actually be harmful. Yeah. So I would say the majority of the preclinical evidence is really encouraging, and that most of the time we do see an overall therapeutic effect, but makes it important for us to really study across the board, preclinical and clinical,
to have the evidence to move forward in a way that's really responsible, because like you said, cancer is a super complex disease that we still have so much to learn. And but this research is incredibly encouraging, because if you think about sort of the concept around a patient being able to be a part or feel like they're more of a part of the treatment that they're going through, or maybe they might improve the efficacy of the other standard of care treatments they're going through. That's very encouraging and exciting, and is something we'll continue to cover, because I think it's an area in our field that's really exploding with so much interesting research. I know that there's some great work coming out of Cedars-Sinai. They're working further with brain cancer patients in clinical trials, which is so exciting. And that's the kind of, we really need to see this in more people on a larger scale. And it could really mean a lot for cancer patients down the line. But lots of work to be done. So let's get to work, guys.
Right, gotta go.
Yes, that'd be great. Well, thank you all for joining us for this great discussion. We're definitely going to be covering cancer more frequently, along with a variety of metabolic-based therapies. And make sure you follow, subscribe, listen in all the places that you get your podcasts. Make sure you find us, the Metabolic Link. Also, leave us a review as well, a comment, like if you see this on social media, because that's how we reach more people, and we're able to elevate this science in a way that really makes some big changes, hopefully, in our field and in medicine as a whole, really. That's the goal. So thank you guys for watching. Thank you for the wonderful discussion, guys. And we will be visiting you guys very soon.